I am here with ReMar Nurses. It is the afternoon, and I'm sitting here chatting with two of my ReMar nurses. Say hello. Hi. Hello. And we are in Kingston still. And we're actually, let's get closer. And we're actually talking about challenges of international nurses, particularly nurses in Jamaica. And we're just talking. We're just talking about it. Right. So, hi everybody. People are going to start saying hi to you guys. Say hello.
Hi.
Hello. So we were talking about NCLEX. We were talking about the challenge, ReMar, the challenges of nurses trying to study, international nurses, Jamaican nurses. What sayeth you all?
Well, as it is now, we're having challenges here and there because, as you know, we're international nurses. We do things a little differently here. We don't have all the resources. Resource plays a big problem here. So we may do with the little we have. So whereas you would do this here, you know, when you're in the US, you can't do it because, and then to our understanding is that NCLEX is a perfect place. You have everything, you know,
That's
perfect.
a good point.
All the nurses
That
are there, all
is
the
a
doctors,
good
all
point.
the everything is
Right,
there.
right.
So that in itself is a very big challenge.
It's
But we're
the
happy that
mindset.
Regina is here and Mark is here as well to help us along.
Yeah.
And they're giving of themselves freely.
Yeah.
May God bless
Truly
them.
admire that.
Yes. So how are you, tell me about how you're working for the ReMar nurse family here in Kingston. Tell me let the nurses know all of what's happening, how the ReMar nurses in Kingston are holding it down for me.
We are so excited. We are so happy to have you here. Welcome, welcome, welcome. Enjoy your stay. It's really good to have you.
What did you do yesterday?
Yesterday I went and I spoke with a few nursing students, and they're so excited. They
to have
can't
you here.
wait
Yeah.
for the conference. They're just waiting in anticipation. They're just here preparing themselves for exam. It's really a busy time around for them now. They're having clinicals and they're having exams soon, so they're really preparing. But they're just anxious to have the seminar in March.
The Nurse Success Summit. What is the biggest benefit of taking NCLEX and passing it? And both you guys exit. What's the biggest benefit about getting that NCLEX accomplished?
Well, NCLEX is everybody's dream.
Yeah.
Why would you want to stay here where you're not appreciated? The money is not really the money. You're not being paid. You can't take care of your families. Your dream, you didn't go to nursing school for 5 or 4 years to be living as a laborer or as a helper.
So you're motivating
So
right
you
now.
want to, all of us want to pass our NCLEX, and we want to go somewhere else where even if we're not appreciated, then we can be paid. And you can learn. No, but you can learn. It's about learning too. So you are taught this way, but then you can go to elevate yourself academically and then financially so that you can care for your family.
And I mean, the resources are there, right? So
He said, ain't that the truth?
No, that's the truth. I've always been known for speaking the truth.
as I was saying, the resources are there. So, I mean, why not go to a place where you have the resources, right? You can effectively care for your patients, not feeling stressed out of, okay, I need to make this work this way. Yes, it's a good thing because, I mean, you still know how to survive on little to nothing, right? But you are able to effectively care for them without being stressed out as much. So,
we in America, we complain a lot about nursing sometimes. It's stressful, but it is true. I mean, I think hospitals in general provide things for us where we don't have to work without, we don't have to work without gloves. And not saying that you guys have to work without gloves and things, but I know I've talked to nurses in Australia, and over there they say, when patients come into the hospital, we don't have pillows or blankets for them. They bring their own toothpaste, toothbrushes. We provide all those things in America.
We have gloves. We have gloves.
Yeah, your gloves.
We have gloves. Well, we need sheets. We need like beds. We're lacking. We're lacking beds. Just the other day I was at work, and we were admitting, and when I looked on the persons who are there suffering, and they
Yeah,
didn't have
they're
enough
sitting on
beds, and they're
chairs
sitting
and
on
all of that,
chairs,
yeah.
it
For
just
hours.
grieved my heart to know
Yes.
that, persons can suffer in this way.
It's
you
true.
know, and we study for so long. We just want to be of benefit. Sometimes you feel helpless. Sometimes I just walk around and give them a pat and I say, you know what, just pray for us. Pray for us.
Yeah.
It will get better
True,
someday. That's
exactly.
all. Because
Exactly.
sometimes they feel as if you're doing nothing. And little do they know that we're
You're
going
doing your
crazy.
best.
You're
Yes,
doing,
you're
you're
trying your
behind the
best to
scenes.
ensure that they're okay, that their well-being is basically not well-being. Well, they're coming back to health. You
Yes.
are doing everything you possibly can, and sometimes it's not appreciated.
Yes.
Sometimes
that
you're
can
on
be
the
so
phone.
stressful.
You're
It
on the
is true.
phone and you're calling another ward. Can you board some of these patients for me?
Right.
And can I borrow this? Can I borrow that?
Yeah.
And they don't even know what you're doing. Although, yes, sometimes we communicate and we say, yes, sir, as it is, you see the situation. We're lacking in this and we're lacking in that. But just bear with us and
Yeah.
remember
Yeah.
to pray for us because
Exactly.
it's really rough.
Yeah.
Yes.
And we're trying to make the most of nothing.
Yes.
Yeah.
You know, but
Yeah.
sometimes they
Definitely.
don't. You're in your pain. Oh, there you tell me
Yes,
that
yes,
I'm in
exactly.
pain. I
Yes.
need your help.
Yeah,
That you're not
yeah.
saying anything.
They're
You're
not
not
This is
understanding
real.
about
This is
it.
real. This is real nurse
Yeah,
talk.
yeah,
This
yeah. I
is
tell
real
you,
nurse
it's-
talk.
It's really a struggle. It's really a struggle.
Yeah.
And so over time, you find that nurses burn out.
Yeah.
Yeah.
Because
Yes.
you're caring, you're doing the caring, and you're not being cared for. You stand on these legs for
Yeah.
long hours.
You don't get to use the bathroom at all for the day. Oh
I think
my
that's like
gosh.
universal though
Yeah.
in nursing. Like we were
Yeah.
just talking about like how hard nursing school was just to even get through nursing
Yeah.
school. One of my biggest pet peeves is that for the NCLEX or the ReNR to stand in the way of the next step for nurses.
Exactly. That is so true.
So let's talk about ReNR. Quick facts ReNR that we will be having at the Nurse Summit, Success Summit in Kingston. And let's talk about the importance of having a resource for the exam for ReNR, for those who are preparing to take ReNR, because both of you guys have taken
Yeah.
it
Sure.
and passed it.
Sure. We're nurses.
Yes. So let's quickly talk about ReNR and then let's quickly talk about NCLEX prep. Okay. So
All right.
listen. So ReNR. What is ReNR? Because some people like don't even know what ReNR is.
Well, this is the regional examinations that we do
For registered nurses.
for registered nurses. So you'll find that we're a little behind the rest of the world in that multiple choice was just recently introduced. It was introduced maybe in the latter part of 2014, 2015. My batch was a guinea pig for that year. And so back in the days we still do it. We take our exams by pen and by pencil. We
Pencil and
shade
paper,
in,
right.
so you can go back. You can, if you're having difficulty with question number 1, you can
You
go
can
back.
always
You
go
can put a
back,
dot on it,
yeah.
and you can do 50, and you'll go back when you remember or whatever.
Wow.
Yes.
Yeah.
So we're having a bit of
What kind of
challenges.
things are on the ReNR?
So you have, it's a wide range. All the things that you do in nursing.
In nursing,
school.
Yes.
All the-
Questions from
It's
everywhere.
that mismo.
It's so,
Yeah.
It's
Questions
a
from
whole-
everywhere.
It covers everything that you've done
It
in
tries to
nursing
cover
school,
everything.
in nursing
Yeah,
school.
it
So, but you have to do it manually.
Yeah.
We have not gone electronically.
Computerized just yet.
Yeah, so some of the nurses students here are saying that they write their exams too, like they literally write them instead of it's on a computer. So how are nurses preparing for ReNR currently? What are they doing?
Well, all the resources that we have had over the 5 years. Remember, nursing books are so huge. There's
And
so many
expensive.
things to read in those
Yeah.
books, and so we read and we read and we read and we cram and we cram and we cram and we do our clinicals, and of
Yeah.
course we have well-trained nurses. We have to hats
That
off to our
assist us.
well-trained nurses, our hardworking nurses
Yeah,
at
absolutely
the
here.
institutions.
Yeah.
They're doing their best, right, to supply to prepare
support.
us. To
And
prepare
support
us.
us.
Yeah.
Yes,
Yeah.
they're doing their best. But as you know, we're still behind the world. It doesn't make sense you hide it. So, NCLEX, so ReMar is here with their new baby to assist
Yes.
the nursing students
With the ReNR.
with ReNR.
Perfect. Yeah.
So yesterday I was out talking to a few nursing students, and they didn't really know about the quick facts, but as it is, they're really excited when it comes to ReMar. They go on their YouTube pages and they go to Facebook, and they're all aware of what ReMar is doing.
Yeah.
So, and they all welcome you here in Jamaica.
Yes, where else will I be welcome? What other country will welcome me like Jamaica? Because they have shown me some crazy love here. So you guys are both studying for NCLEX, huh?
Sure.
Studying for NCLEX. Okay.
And here it is. I have my quick
Oh,
facts.
you got your quick
And I
facts.
have my DVD, my brand new DVD.
Yes.
Which is very resourceful.
Yes. So we have a shout out. My aunt just retired from Spanish Town Hospital. Do you guys know that one?
Of course,
Yeah.
we know Spanish Town Hospital.
Okay, so St. Vincent, go there. He was telling me, go. Yes, these ladies are from Jamaica. The accent is there. The accent is there. So let's talk about NCLEX real quick. Are you guys coming to the Nurse Success Summit?
We
Of
have to be
course.
there. That
Of
is
course,
a
that's what
must.
we're doing.
And we're working assiduously to make it a success.
Please, we
Yeah.
got the flyers. We're going to flood
We're
the
going
city.
viral across every nook and cranny in Jamaica. All the nurses in Jamaica, they are going to be here. I don't know if you're going to have space
Yeah,
to accommodate us.
everybody. Right?
Oh my goodness, it's gonna be so crazy. And then you know what, I love the pride of the country, because like everywhere I'm going, there's like Jamaican flags and things like that. I don't know if we do it like this in America. I don't think we do. But I got a shirt. We did a shirt exchange because they brought me a shirt. And I didn't say you guys introduce yourself. You gotta say your first name, just your first
Oh,
name.
my name is Natalie.
Natalie.
I'm Shanae.
And Shanae. So they came to visit me and they brought me a shirt. And I was so out. Look, bam. So and when I wear this, you guys already know what time it is. But then we did a shirt exchange. So they gave me a shirt and then I gave them a shirt. And then so now we're triplets today here. But so we are talking about, did I try jerk chicken yet? Jerk chicken, yes. Was it jerk chicken? I think so. I don't like spicy food, and I have a problem here in Jamaica because everything is spicy.
Spicy. Yeah, we love it. Yeah.
So I don't know why the food is so spicy here. But
So
that's-
nice. We call it
nice.
delicious. It's not spicy. It's delicious.
So I haven't eaten much here, but no. So we're studying for NCLEX, and what we're really trying to do is we want every nurse in Jamaica that takes the exam to pass it. That's it. Like on the first time.
First 75 questions.
Yes. Yes. There's this stigma with international nurses that, and I guess it's stigma, but it's also truth too, that when international nurses take NCLEX, they don't pass it. Statistically, they have statistically it's proven that international nurses, when they take it, only about 37% pass it.
Yeah, I saw that statistic.
Yeah. So what's up with that?
Well, you have the resources. Come on.
Mm-hmm.
You have the resources, so you're going to pass. So, but we have to be struggling with a lot of things.
Yeah.
that's
You understand? Some
The
of the
work
things you did
hours.
on your Facebook and on your YouTube, you did chest tubes, right? That 3-chamber thing you're talking about, it's on in the book.
Mm-hmm.
In where I work, I'm accustomed to chest tubes. And my thing is different. I'm accustomed to the 1-chamber, the underwater seal drainage, and that's it. And with the tube oscillating, that's it. The 3-compartment that you talk about, I'll have to Google it to know about it. I don't know about it.
That's true. It's
So
true.
we're gonna have a challenge because you do things differently.
Yeah.
Yep.
So we
And
have
as
to
you
learn
said,
it.
the resources are there. So I mean, when we can relate to making use of what we don't have, and we go, all right, this works. We don't have this, but we do this and it works. We can probably still have that practice, in our heads. We know the right thing, but because you've been practicing this one thing over and over and over, when you go to do that exam, you're like, all right, how did this go again? Yes, you're studying, but the practice becomes a part of you. So, it's kind of hard to go back to the right way that you had already learned. So
That's
I
true.
think, that's one of the challenges.
I think another thing, and the student just brought it up, is that international nurses typically are working, they have children, and they're trying to study for
Yeah,
NCLEX too
that
as
is
well.
And not only that, remember we talk about the money issue.
The work hours,
You have to do your
sessions,
regular work,
right.
and then you do your session, and then you have to go home to the
Less
kids,
time.
and you don't have the time. You really don't have the time. So NCLEX becomes a problem. It becomes really a problem. And then you're given a time frame in which to do it. The program in which you sign up with, if you sign with a program, you have to, it's structured. So you have to work with their structure. And sometimes it doesn't work. It really doesn't.
So,
and the books are so huge. Thanks to ReMar. They just, such a small, right? So you can read it, you can rehearse it, and you can memorize it, you can know it back to back. Or should I say back to front or front to back?
Yes.
Whichever you want to say.
Yes.
Whichever works for you.
Yes, this is I try to make the products friendly.
And then if you're busy in the kitchen, like for me, if I'm cooking, I can be
just
listening, and if you're ironing, whatever it is that you're doing, you can always get yourself engaged.
Absolutely, absolutely.
Good.
So so like last minute, just encourage my international nurses not to give up. Give them reasons why, even though they may have all of these challenges we talked about, why not to give up.
When you became nurses, you had your goals set on one thing. You know what that one thing is. So you know you need to keep your eyes on that. Keep your eyes on your goal, right? Don't give up on your dreams. Don't give up. Keep working. The heights by great men reached and kept were not attained by sudden flight, but they, while their companions slept, were toiling upward through the night.
What is that? I missed that. What was that?
Okay. As we're saying, just work hard. Just work hard.
I mean, but was that like a saying that people in Jamaica know?
Yes,
we grew up on it.
Yeah.
That's something I learned when I was in secondary school, primary school. So, my mother would ring it in my head, your friends are studying, you can't be sleeping, you're playing all day at school, you need to be studying, you need to be hitting the book. So, it becomes
That's what I say every Monday. You're playing, you need to be studying.
Yeah. So it
do what you have to
of
do.
you, right?
Do what you have to do. Nobody's going to give you anything. Just that you have to work for what you have. Right?
Absolutely.
And most persons who become rich, they just didn't come rich overnight.
Exactly.
They have to put in the work.
They put in
the
the
work.
Absolutely.
So you put in the work, you study, and don't complain. One day it's going to get easy. One day it's going to become easy. And guess what? You're working with some good people. We are a family. Here at ReMar Review, we are a family.
That's what I want to say. What does being a ReMar nurse mean? Like, what's a ReMar nurse?
It takes care of the whole nurse. Your spiritual aspect is taken care. Where can you go to find somebody you can be prayed for?
Exactly.
Right? You can be encouraged.
Exactly.
It's not all about money.
Yeah.
Get this. It's not all about money, as you're aware.
Yeah.
You can always go on YouTube and YouTube something from ReMar Reviews. You have 7 days of NCLEX free.
Yeah.
You can always send a message and you get a response instantly. Where else can you go and get that? Nowhere else. So it's a blessing. ReMar Review is a blessing. Take advantage of it, people. Pray for the family. Pray for Mark and Regina and the whole ReMar group that this thing becomes a success, right? And it is going to be a success because they're giving it straight from the heart.
Exactly.
Yes.
Right?
Yeah.
I feel them. When they're teaching, I feel them.
Oh, you know what? Everybody is just like really resonating with you. Somebody said, "Can we call you Auntie?" Can we? Because you're just keeping it so real, and I think that's what we need. Sometimes we need somebody to say, "Look, these are your goals. You have to do the work. It's not going to be given to you. Nothing about nursing is handed to you. Matter of fact, it's so much the opposite. It's like we eat our young. Like for some reason, in the culture of nursing, it's very it can be very harsh. The work environment, the care that you're expected to do can put a strain on you. It can emotionally drain you. The process. I mean, they teach us even in nursing school. It's like if you get through nursing school, you have survived the harshest environment that you can think of. So we lift each other up here. We really do.
Yes, others have done it before. You can do it too.
Yes.
And guess what? We're doing it in 2019. You believe it.
Absolutely.
Say it every day and you believe it. Yes. This is a year of jubilee for us as nurses.
Yes, it is. Yes, it is. There's going to be a big change. And Gil said, I'm scared, Regina, you won't leave Jamaica. I do really like it here. They're going to keep me hostage.
We are going to keep her hostage here.
So no, it's really like a home. It's really like a family. And you know what? What I've learned is that there's a certain mentality that you have, and I think if you have a certain set of values and you see nursing as bigger than just yourself or a paycheck, then you are able to look at another person and have compassion on them and see where they are and encourage and motivate them. So thank you so much for joining me. My two ReMar nurses representing Jamaica. So yes, they are real. None of this was pre-planned. They're saying their own words, stuff straight from their heart. So tell the ReMar nurses goodbye.
Bye.
Thanks for having us.
See you at the summit in March.
Yes. All right, guys. Have a good day. Bye-bye.